when you should go for an angiogram. My name is Fernandes. I'm your founder and director of the HeartFit Clinic. And many people are going for calcium scores or CT angiograms just for preventative reasons. And it can lead to dangerous interventions, which are not necessary anymore. I'm going to explain that. I'm going to actually share the data with you as to the pros and cons for going for a CT angiogram. So the first thing to understand is that these arteries are a muscle. They're not a pipe. And if you don't believe me, you can feel them. You can feel them expand and contract in different spots in your body. And all of these arteries expand and contract, and especially the ones of the heart. So when you look at the anatomy of the heart, it's a lot different than when we think it is. It's not a pipe. Inside the lining of the artery wall is all skin. You can see that here. It's called the endothelial lining. And that endothelial lining has to get damaged. And when it gets damaged, cholesterol gets used up in a negative way. So it's an innocent bystander just getting used up in a negative way. And then just like a sliver goes into the hand and you're not able to get it out with tweezers, it goes through an infection and an immune response. And that's what builds up inside the lining of the artery wall like a pimple. So here's the progression of artery disease. Obviously, we all want healthy arteries here and we want it healthy. But after that, this is not healthy. After this part of it, it's not healthy. And most cardiologists and CT angiograms are looking for a plumbing problem, and it's not a plumbing problem. And I can share countless of situations of what it is. But an angiogram is great because it does look right inside the artery walls. But why it's not great is because there is an immense amount of radiation that goes through it. There's a contrast agent, and it only looks for the bigger arteries. So 300 micrometers. To give you an idea, if I take a width of my hair, that's about 30 micrometers, right? And you can see that on the left image. This is all the arteries that you can grow. I've seen people grow new arteries around blockages all the time. And in fact, if you Google this, and I wish I could do this right now, but if you Google just how, what is the percentage of heart attacks that are silent, meaning that you don't even feel symptoms, it could vary anywhere between 30 and 70%, maybe depending on the studies. But they say on average about 45% of heart attacks are silent, meaning you don't even know about it. And the reason why that can happen is because you can have a plumbing problem that is so gradual that your body takes over and grows these new vessels. And this is what we do at the HeartFit Clinic. We get to grow these new vessels. And also, anyway, why it's not great is, of course, you got to keep your heart rate nice and low to stabilize the images. So it's really good at looking at the big arteries, not so great at looking at the small ones. And it does get better to understand, for the patient with artificial intelligence now with Clearly, and you can look at these arteries, really cool. So it can actually tell you what's going on. But again, the radiation exposure is not worth the risk if you're not symptomatic. And so the sensitivity and specificity of the testing, so how accurate, we'll keep it simple, how accurate is the testing is anywhere between 82 and 92% to the angiogram, right? So here are the outcomes. And this is the important part to understand is when you look at the outcomes, either it's low risk, so everything's okay. And this is talking in our healthcare system, right? So everything's okay, but is it, right? You can have construction on the side of the road and have the biochemistry start to fill up, and that could be a problem. But come back when it's more at risk and take a statin just to make sure. That's low risk. Well, if you're moderate risk, it's not bad enough. Come back when it's a little bit more at risk, and then, we'll take a statin. Or it could be high risk. You know what? Let's do a conventional angiogram. Let's go poke around a little bit more radiation, more contrast agent. It damages the endothelium even further, and a stent or bypass is not life-saving. And by the way, take a statin. Those are your outcomes. So it's not so great outcomes. Like take a statin. Cholesterol is not what causes heart disease. I can share countless of data on that. It does not look at the health of the artery wall, and it does not look at the biochemistry of the artery wall. It doesn't look for inflammation and vulnerable particle sizes that can sliver through, and understanding the infection and immune response. These are important things to know. So when you go to your doctor or inside the healthcare system, there are 3 treatment options. Either we stent you, or we bypass you, or we do medical therapy, which includes a statin. And blockages don't always need an intervention. And so where this all comes about now is we changed our minds in the literature. And so what happened was, and here's a journal article on this, and stent cases in the criminalization of medical judgment. What happened from 2000 to 2010 is that people everywhere were getting CT angiograms and just starting to do angiograms. And all of a sudden you would end up doing a catheterization where you end up going inside the artery walls and see where the plumbing problem is. And at that point, they would do stents. And they found that there were a lot of people that were no symptoms getting stents put in. And they were looking at a whole bunch of situations that they were happening. So this was like, this was common in the US, in Canada as well, but US got on top of it because insurance companies were paying a lot of money for heart stents, where they're like, why are these centers doing so much more? And so they started investigating into this. And this is what led into the COURAGE trial. This happened in 2005, 6, and 2007. It was published, and it basically said that medical therapy is just as good of a treatment option than putting in a stent for stable coronary artery disease. You got to take away your mind that these arteries are a muscle. They're not a pipe. And this is the COURAGE trial. This is published in the New England Journal of Medicine. It says that medical therapy is just as good as doing a treatment option. So we didn't believe it as well. So we didn't really change the way we did it. Maybe we got a slap on the wrist of doing this. And the FAME trials came out looking at fractional flow reserve and instrumentation ratios and all this. And so it basically looks at the flow of the artery wall. I don't want to get into too detailed, but it started to say, okay, well, here's a benefit, here's not a benefit. But then the ORBITA trial came out, and this was, when was this study done? This was in 2017, and it basically showed these are people with chest pain. So good reason, go in the hospital, get chest pains, go, and you came into your family doctor. So you went to your family doctor, you failed a stress test, a nuclear stress test maybe, and now they're doing an angiogram, and they found that heart stents fail to ease chest pain, that there was a placebo effect to actually putting in a heart stent. And then there was the ischemia trial. And it basically showed, this was a big trial that came out in 2019, late 2019. And we were forced to follow it when COVID came out. And it basically shows that surgery for blocked arteries is often unwarranted. That drug therapy alone may save lives as effectively as doing bypass or stenting procedures. So these are all the trials to support that doing a CT angiogram may not be the best thing, because I got a lot of people that are doing this. And so knowing all of this, at the HeartFit Clinic, we recommend healing the artery wall, understanding the biochemistry of the artery wall, and more importantly, understanding symptoms. It doesn't matter how much money you have or how much connections you have. Doing a CT angiogram should be only done if you're having chest pain, in my opinion, and bad enough chest pain to actually look at this. So these are the things to be able to look at to understand when you understand cardiovascular risk, because you can look at this. Basically, what happens is that when you look at blockages, you can see that you got limited blood flow here. You can improve blood flow and grow new arteries. And here's the focus. You can improve artery function, and you can change the lipid core. You can see here on top, this is a vulnerable plaque to rupture. And with this one down here, you can shrink the lipid core and prevent and strengthen the skin over that plaque. And this is what we do. So instead of that, this is where we have the AI scanner at the HeartFit Clinic, where we can be just as accurate. You can see we can just be as accurate as the angiogram, but also looking for these smaller blockages and microvascular disease without doing any radiation and without any risk to the vessel. And if this is of interest to you and you want to get more information, we can prevent and reverse heart disease. You can call our clinic. Here's the numbers here, and go on our website. And we look forward to helping you live happier, healthier, and longer.